Hello and welcome to Strong Talk, a podcast dedicated to the discussion of equity, diversity, and family as it relates to mental health and addictions. A space not only to talk about challenges, but to explore and create space for solutions. I'm your host, Vic Armstrong, and I want to thank you for joining me on this journey. Today, I'm joined by my friend, Judge Ginger Lerner-Wren, the pioneer of America's first mental health court back in 1997, creating a human rights model dedicated to the decriminalization of people living with mental health challenges. She also serves as the presiding county court judge of the Misdemeanor Mental Health Court of the 17th Judicial Circuit in Broward County, Florida, and is a judicial representative for the executive committee of the National Action Alliance for Suicide Prevention. Judge Wren, thank you so much for being with me today.
You know something, Vic? It's been a long time since we were on a panel together. I think the last time you were on my panel for the United Way of Broward County, and it is always between here and XCOM. Anytime I could spend time with you is just an absolute thrill.
Well, thank you so much. The feeling is mutual. You have been not only an inspiration for me in the field of mental health, but you've been one of my heroes in this field because you did something. There are not a lot of people who can say I was the first to do something, but you were. You were, as I said in the beginning, you were a pioneer. Can you explain to folks who may not know exactly what a mental health court is?
I will, of course. And I want the viewers to know that before I do that, that I did come from a rather unique background. I actually come out of the disability rights
Mm,
space. And I was a former public guardian, and I was overseeing a federal class action at our state psychiatric hospital, which is actually serves the bottom half of the state of Florida, but it's located in Broward County. And so all of that experience really gave me the skill sets, if you will,
mhm.
and the training to lead and initiate a specialized mental health court. So, what is a specialized mental health court for those that may not know, although they're very popular across the United States and internationally? But this is comes under really the sphere of problem solving courts, problem solving treatment courts. And I think everybody's well aware of the drug courts, the drug treatment courts. The first one, ironically, started in Florida, in Miami-Dade in 1989, responding to the cocaine epidemic. We all remember those cocaine cowboy stories, and it was really Janet Reno at the time, who was not the former U.S. Attorney General, but was the state attorney for Dade County. And she recognized that there had to be what you call, Vic, some more innovative
Mhm.
strategies, because so many young people were getting arrested for possession
Right.
of cocaine and then ending up in prison or jail, and it was like a conveyor belt of incarceration. Then there wasn't any treatment in the jails, and then people would come back out into the community, they would recidivate, and it was just endless. And so from that model, my community, decided back in the early 1990s, that we had a terrible, terrible problem in
Mhm.
our local jail system. What was the problem? It was the overrepresentation of persons with serious mental illness and co-occurring disorders, and perhaps other neurocognitive disorders that were ending up behind bars.
Mhm.
And largely because they couldn't access care, or because of the stigma surrounding mental illness. But nonetheless, our jails began overflowing with people with serious mental illness. Judges were not trained, lawyers were not trained. We didn't have any really substantive community system of care to talk about. And so the community met. They got together. It was the first time that all of these stakeholders actually formed a task force. And after meeting about 2.5 years together, and I was working at the state hospital, I was not part of that process.
Right.
There was a consensus looking at the drug court model that maybe what we should do in Broward is start our own specialized mental health court, bringing in a judge with specialized skills. I had just got on the bench.
Mhm.
I ran unopposed. I got to the bench. Technically in 1995, but my term didn't start till 96 or so. And to make a long story short, they recognized that they had a judge who was trained. And all of a sudden, I get the call from the chief judge. Congratulations, Ginger, you're our new mental health court judge. And when do you want to start? And I said, if you could just give me 10 days, 10 days.
Wow.
Because quite frankly, Vic, I thought he might change his mind. Um, Very conservative judge. And, but nonetheless, the court turned 28 years old.
Wow.
It is, like I said, it has been just diverted over, I don't know, 25,000 people out of Broward's jail, plus studied, evaluated. There's so many mental health courts and collaborative courts now. And really the the credit really belongs to what I always call a courageous
Yeah.
community. We had no money, no grants, and all of these service agencies, remodeled their system so that they could support the work of the court.
Well, I have to tell you, back around 2000, I want to say 2011, 2012, somewhere around there, I was a part of a group, and I actually led a group in North Carolina, in Winston-Salem, North Carolina, to establish our a mental health court for us here. And you were the inspiration for that. Um,
Huh.
looking at the things that you have been able to accomplish, so much so that the very first thing I did, because we did at that time, the administrative office of the courts had stopped funding. They weren't funding mental health courts, and so we'd have to come up with the resources. And the first thing I did was find a judge who was willing to be a part of our planning committee, and that made all the difference. And I did that really because of what you have been able to do down in Florida. So thank you so much for what you've done. But I do have to ask you this question, and this may sound like a very narrow, stereotypical view of judges, but we generally think of judges as being just that. They're there to judge. They're there to assess whether someone is guilty or innocent. We don't think of judges as coming from a place of compassion. We don't think of judges as thinking, this person doesn't need to be in the legal system. They need to be in the healthcare system. Where does that come from? You talked a little bit about your background, but where does the motivation to actually be that type of judge come from?
That is such a great question. And again, that really goes back to two incredible, distinguished law professors. One from the University of Miami, the other from the University of Arizona, who came over to Miami to visit his mother. And these two law professors met up and they worked together to develop this new philosophy surrounding the law called therapeutic jurisprudence, recognizing that the way judges talk, the way they interact with the public could actually change the psychological forces in a courtroom.
Wow.
And people, if they feel that they're heard, if
Mhm.
they feel that they're cared about, if they feel, that their voice has meaning, that they're more likely than not to accept the court's rulings and outcomes. And so when I started the mental health court, it was very clear to me that TJ, we call it TJ in the field, that TJ was going to be a centerpiece of everything the court does or I say. And that goes for the lawyers too. And so I think the tone of the court, the humanism of the court, the compassion of the court is critical, especially when we're dealing with populations that are so, as I say, so marginalized.
Right. So, how does a person find their way to mental health court as opposed to, just being incarcerated?
So when the court was established, and I just want to say to your viewers, there was a recent rotation. I'm not doing mental health court in the mental health court right now. I am doing my mental health court work in my regular division. But there was at the time, a consensus that we just really needed to do something.
Hmm.
The mental health court was our something, and it was really, and like I was talking about the TJ piece of it, um, it's so empowering to have the freedom as a judge, whether it's in a problem-solving court or in your regular division, to be able to be empathic, caring, and really want to help people.
Yeah. Yeah, it is. I mean, it is. It's refreshing. It's refreshing in a number of ways. One being that I think more and more we see sort of a separation. I think, and especially when you talk about like for me as a black male, when you think about communities of color, there seems to be such a separation between the community and the legal system, and especially the judicial system, to the point where you don't really think of the system as being in support of you. You can often think of the system as being adversarial, and I think to demonstrate that the system can be there to help people, many of whom are at their lowest point, um, but you would not expect to find the help and the compassion necessary in the court system. So it is it is extremely refreshing, I think, to hear what is it that you're doing there.
Thank you.
But you've also done something else that's different, because you've added a component of suicide prevention to your mental health court. You want to talk about that? How did that happen? And
That
just
is a wild story. So, I was in Rochester, doing a speaking, on a panel, um, and I'm waiting for our turn to get called to speak, and all of a sudden, I get this alert on my phone, and it's a New York Times article, and this is going back now to 20, I think, 16,
Mhm.
and the New York Times article is, the caption is "Suicide Surges 30% across the US." And it flipped me out, across every sector, every age group. It was just this really scary, frightening article. And I remember going around from table to table to table because we had all these experts, mental health experts in the room. I go, "Did you see this? Did you see this?" And then I realized I thought about it on the plane at night going home back to Florida, and I thought to myself, I'm a mental health court judge, and I never, ever talk about suicide.
Mm.
I never even use the word. I would just defer to clinicians if that was an issue, let them get treatment or help in the community. So I just kept not thinking like that. And then after that article, I decided I was going to take suicide prevention and actually make it the top priority of the court process. And that's why I kind of renamed the court in a sense as a zero suicide initiative court.
Wow, that is fantastic.
And we talk about it every day,
Yeah. And so
every day.
now, to your knowledge, is any other court system doing this?
Not to my knowledge.
So you're pioneering again.
I guess.
But,
I guess.
but that also speaks to the fact that the system has changed. So over time, things have changed. New developments have come on. Um, have there been changes that you've noticed over the years, positive or negative, in how this has worked?
Well, first of all, in terms of treatment courts, I just think they're one of the most important innovations across our legal system and across the world. Um, to be able to now use this process, and just like you're saying, instead of calling balls and strikes,
Hmm.
but we're actually, filling gaps, filling treatment gaps,
Yeah,
and using the power of collaboration with our community stakeholders to make a difference. And I think fundamentally it's transformative.
yeah, yeah.
It really is transformative. And I know that, not everybody may, and I'm also a longtime university professor in the field of forensic psychology and criminal justice for Nova Southeastern University. So I know I'm very data oriented,
Hmm.
in what I do, and I'm very evidence based. And I just love to use the courtroom as a classroom to teach about adverse childhood experiences, the impact of trauma. I love to teach that as I work.
Yeah, that's fantastic. So as we're thinking now about, because we're still in this state of change, society's changing, our resources are changing. So let's just brainstorm a little bit, because we now have things like 988. We have a national strategy for suicide prevention. Do you have thoughts on how mental health courts, or just in general, how we approach mental health and the legal system? Do you have thoughts about how these things will impact us differently, or things we should be thinking about as we're thinking about 988 and our national strategy?
Well, one of the things, I'm so glad you asked me that, because I was going to talk about this at XCOM, but I'll talk about it now.
And by
If
XCOM,
you
can you explain to our listeners what XCOM is?
Oh, sure. Sorry. That stands for the Executive Committee of the National Action Alliance for Suicide Prevention. That I'm on, you're on the executive committee. And these are the meetings that, we talk about, how we could improve our strategies.
Absolutely. Thank you.
Sure. And one of the issues that uh, we were talking about at the United Way had to do with the fact that many young people are not likely to use 988 or
Mm,
even want to talk to a crisis counselor.
mhm.
The data is really, quite frankly, very disturbing. So, for example, there was a survey done in Broward County, and the question was, how likely are you to use 988 hotline if experiencing a suicide crisis or emotional distress as a Broward County student? 58% indicated not likely, 58%. 26% said somewhat likely, and only 17% of those students surveyed said that they were very likely to use 988 or talk to a crisis hotline counselor. That's worrisome to me. And I think that we should really focus on this data and, really maybe explore that at XCOM, um, and among ourselves, because it's worrisome to me.
It is, and I think, one of the things I think you and I both have seen too much of is people with mental health challenges ending up in jails and prisons. And I know that's part of your incentive for doing the work that you do, and it happens far too often. So what we do is we essentially criminalize mental illness. because we have so many people who end up incarcerated because of things that happen as a result of their mental health challenges, which often occur as a result of us not having the resources in the community where people live, work, play, and worship. And so it just creates this vicious cycle.
It does. Absolutely. You're so right.
But now on the other side of that, do you have a success story that sticks out in your mind? Is there somebody or some situation that sticks out in your mind that stays with you about a life that was changed or touched or
I
something like that?
I do. And I'm so glad you asked that. And I'm not plugging my book, but this vignette that I'm going to talk about is in my book,
Uh-huh.
A Court of Refuge, Stories from the Bench of
Where can
America's
we find that book?
Amazon.
Okay, all
It's
right.
by Beacon Press. And in this, and I give all different vignettes from the court,
Mhm.
and one happens to be in the middle. It was I was in the courtroom after my one division and then before the start of the next division. And there's this man, and he's sitting all the way in the back of the courtroom alone. And my deputy went over to talk to him. And I said, and then I asked the deputies, what's going on with this man? And he said, well, he seems like he's very upset. So I went down into the, into the well where the pews are, and I sat down next to him, and I said, "Sir, is there anything I can do for you? You seem very upset." And he said, and he basically, he started crying. He said, "I lost my job. I'm an accountant." He said, "I cannot find work.
Oh,
I
wow.
don't know what I don't know how I'm gonna pay the mortgage. I don't know what's gonna happen to my family." And I I just kinda intuitively said, and I'm so sorry to hear this." I said, "Are you feeling like you could harm yourself?" And he said, "Yes."
Wow.
So I called Henderson Behavioral Health Center, our largest and oldest mental health center in Broward County, and they have a mobile crisis team. And I called the mobile crisis team, and they took him over to a hospital, and I was very grateful for that. Moving forward, about advancing about maybe 4 or 5 months later, I'm in court at a docket, and there he is.
Wow.
And I hardly recognized him, but I remembered his name, and I said, "Oh my gosh, is that you?" I go, "You look amazing."
Wow.
And he said, "Judge," and I get very about this. He said, "Judge,
Oh, wow.
if it wasn't for you," he goes, "I don't think I would have made it."
Wow. Wow.
And, it's stories like
Yeah.
that
Yeah.
that you just can't believe how important, this work is.
Yeah. Oh, that's amazing. That's a fantastic story. But so you, Judge, you are one of one. I think the world of you, but you are one of one. Is there a any formal training or process or way of training judges to do what you do? Is this something where judges can choose this path?
Well, I think they can, if they want to. I mean, we do have, judicial conferences, where problem solving courts are talked about. We have educational programs through the state court administrator's office. I think I personally feel, it's a calling.
Hmm.
It's a calling, and I know you relate to that.
Absolutely.
Um, that's very personal for people who really want to do this kind of work.
Yeah. And so, but it's not something that they're introduced to in law school or anything like that.
I wasn't
Yeah.
I didn't even know about I never even learned about the criminalization of persons with serious mental illness until I was at a conference. But so I don't know how much the
Mm.
law schools are focused on this topic. I'm sure it's a lot more than it was when I was in law school, feeling like a million years ago.
So as we're thinking though, as our system is evolving, and we do have all these different things coming online now with, as we talk about 988, and we have this national strategy. I am hopeful, especially because you've laid out the blueprint, that we can see a system going forward where we have it really built into our justice system, that people have opportunities for things like mental health court, because I've seen it work. I know how effective it is. The story you shared is an indication of how effective it can be. Um, but as we wrap this up, and I have enjoyed this conversation so much. I always enjoy talking with you and just hearing about your journey and the just the amazing things that you're doing. Is there anything that you want to share with our listeners as we wrap it up? Maybe something I haven't asked you, or just a parting thought?
You know, I'm a little concerned over the future. I'm sure that many of us are, and I think it behooves us, to take care of ourselves
Mhm.
more and to really do the things we need to do for our own self-care. And you're in the gym working out every Sunday, giving us our Sunday messages on suicide prevention and whatever else is going on in your world, and we all love it on Blue Sky and social media. So I think that's really what we need to do. We need to care about each other, take care of each other, and really let the compassion flow.
Well said. And thank you so much for being with me today. And thank you to all of our listeners for joining in us today for this conversation with my friend, Judge Ginger Lerner-Wren. Thank you again so much for being
Thank
with us.
you. Thank you so much, Vic.
Thank you. And for all those out there listening, as always, I just want to remind you that you matter, your life matters, your pain matters. If you or someone you know are living with mental health challenges, get support. If you or someone you know are in crisis, you can simply call or text 988 to be connected to a trained counselor who can connect you with the help, with the services, with the support that you need when you need it most. And if you need resources, you can always go to our website, afsp.org. Again, you matter. Your life matters. Your pain matters. And that is Strong Talk. Thank you.